You guys all good? All right. Well, good morning, everyone, and thank you for joining us at our weekly press conference here at Metro Hall this week. We've got some exciting announcements to talk about. I'm, of course, happy to take any questions from the media following that. But first, I wanted to give an update from the National Weather Service on the likelihood of severe weather this afternoon and into this evening. Currently, we've been advised by the National Weather Service that severe weather chances are the greatest between 3 p.m. and 11 p.m. this afternoon. And there may be a few strong to severe storms that come through the area, which, of course, have the risk of producing significant wind and tornadoes, as we saw last week. Dangerous weather can strike, sometimes without warning, as was the case last week. So we want everyone to be aware of this risk, everyone to continue to stay up to date on the latest with weather. We and National Weather Service, and I'm sure all the local media, will continue to provide information and warning. But one thing I want to again encourage everyone to do is to sign up for Lens Alert. Lens Alert is a free service provided by Louisville Metro government that provides emergency alerts directly to your home, to your phone. Whether it's weather emergencies, as might be needed later today, whether it's emergency things related to other activities that happen around the community, please sign up for Lens Alert. It is free, and truly, we've already seen that Lens Alert, combined with the Smart 911 feature that's also embedded into that, has saved lives in this community. For example, when you sign up for Lens Alert, you can also sign up for Smart 911, which means if you call 911 from your cell phone, the 911 call taker will have information about you and your location that it can use to provide emergency assistance more rapidly. We had an individual whose life was saved. His house was on fire. He was in a smoke-filled room, could not talk well. But because that he was on the system, the dispatcher was able to just ask him a yes or no question. Are you home? He said yes. The call taker knew where he was, even though it was on a cell phone, because of the information in the Smart 911 system, and that saved his life. Similarly, there's a texting feature available on Smart 911 where you can text with emergency dispatchers. And I've been told about another story where I believe a life may have been saved, where a woman who was at risk of from violence from, I don't know if it was her husband or her boyfriend. She was hiding in a closet, couldn't speak because she didn't want him to know where she was, and was able to text with the Smart 11 feature so that help could arrive to bring her to safety. So again, please sign up for Lens Alert, whether it's severe weather, whether it's an unexpected emergency situation. This is a great program. We have over 50,000 people that have signed up. To sign up for Lens Alert, you can text you can text Lens Alert, LENS. That's a Louisville Emergency Notification System alert, Lens Alert, to 67283. I would also encourage all of the local media stations to reach out to our emergency management agency, to Jess Wethington there. If you all would help us promote this to the community, to talk about what the system is, to do some profile stories on this. It really is a true public service that we want everyone in Louisville to sign up for Lens Alert. So again, text Lens Alert to 67283. And one more item before we go on, just going back to last week's storm, I want to give a giant shout out. We'll do our Louisvillians doing good at the end of our press conference today. But I want to also give a special shout out to Vincent James and his entire team at Dare to Care. Based on the impact of the storm last Thursday, today Dare to Care is hosting an emergency food pantry for neighbors in the Parkland neighborhood. And so folks who were affected by the storm, who may have lost power and lost some of their food, are welcome to drive through this pop-up pantry or walk or drive there. The pop-up pantry is this afternoon, sponsored by Dare to Care, at 2 p.m. at 1200 South 28th Street. That's 2 p.m. at 1200 South 28th Street. And folks who need food relief but aren't able to make it to this afternoon's pop-up pantry can reach out to Dare to Care, and they can find a way to get it to you if you go online at daretocare.org/gethelp. Again, that's daretocare.org. And I just want to thank our partners at Dare to Care for what they're doing today and what they do every day to help people who are experiencing food insecurity. Our goal is, in partnering with Dare to Care and other organizations around the community, that we no longer have people in our community who do have food insecurity. That is our goal, and working with partners like Dare to Care, one day we hope to accomplish that. So on to our official business of the day as well, beyond encouraging people to sign up for Lens Alert and to be aware of severe weather risk later this afternoon. If my colleagues from Louisville Public Health want to come on up, we've got an exciting announcement to make. Our focus in Louisville Metro government is making our city safer, stronger, and healthier. All of our departments, all 30 plus of our departments around Louisville Metro government, are helping us achieve that mission every day with the work they do. None of them more specifically helps us with part of this than the Louisville Metro Department of Public Health and Wellness. Louisville Metro Department of Public Health and Wellness does incredible work, like helping new mothers care for their babies and for themselves, like monitoring and alerting us to public health threats, as we all saw during the pandemic, participating in academic research so we can better understand how to improve the health of people in every part of our community, particularly where there's been inequality and disparities, and also leading our efforts to achieve greater health equity across the entire city so that everyone in every neighborhood, from every neighborhood, can live long, quality, healthy lives. Our Department of Public Health and Wellness does all of that and much, much more. To do that, it takes a great team and it takes great leadership. And so today, I'm honored to be joined by Connie Mendel and Dr. Inder Singhal. Connie has been our interim. She's been with the Public Health Department for a while. She's currently our interim chief health strategist. And Dr. Inder Singhal, he joined last year, and he's interim medical director right now at this time. In May of last year, I appointed them to these two interim positions, and they've both done outstanding jobs. Here are just a few of the examples of what they have led the public health and wellness team over the past year. They've helped lead the distribution of opioid settlement funds by serving as co-chairs of the Opioid Settlement Advisory Board. They've helped us save lives by making naloxone more available through the community, which helps prevent overdose deaths. In connection with that work, they've made progress in getting people connected with harm reduction, treatment, and recovery services. They've secured millions of dollars to help us expand the Healthy Start program, which helps new mothers and their infants. They've also helped us to secure more funding for the childhood lead poisoning prevention program and to implement the new lead rental registry ordinance that Metro government has been implementing. And there's a whole lot more beyond that. So Connie and Inder, I want to thank both of you all so much for your amazing work. And I'm excited to keep moving forward. And one way to do that is to remove the interim titles from your titles effective immediately. So first, let me introduce Connie. Connie has devoted her career to public service in the field of public health. She has a long list of career accomplishments. Just to mention a couple of them, Connie oversaw the efficient and effective treatment the over $53 million in federal funds that the CARES Act and the American Rescue Plan provided to the city of Louisville as part of our COVID-19 response. And under Connie's leadership, this department secured a $9.5 million grant from the CDC. And now she's overseeing a historic investment in the department workforce. So I'm proud to share a few words with you, the Louisville Department of Public Health and Wellness Chief Health Strategist, Connie Mendel. Connie?
Hi. Thank you, Mayor, for this incredible opportunity. to continue the work that we're doing. I value your confidence in me and Dr. Single to help make Louisville a healthier city. I'm just grateful for this opportunity to work and lead our department, working with over 350 dedicated experts in public health, our public health workforce. There's still so much work to be done. We all know that. Public health is complicated. It aligns with all of Mayor's goals for the city. When we talk about a safer city, a healthier city, gun violence is public health. Obviously, substance use disorder is public health. Thrive by 5, phenomenal program recently introduced. Healthy children, healthy families, which we dedicate a big part of our workforce. That is creating a healthier community and healthier opportunities. All of the initiatives around Metro government in public health. I like to say public health is a team sport. We certainly cannot do it alone. Just earlier today with the talking with Gretchen Hunt with the Office of Women, public health. You can't show me an initiative going on in Metro government that doesn't relate to public health and everything we do. Housing, people need safe, healthy housing, and that's the work that will be improved. Safe housing with the lead rental registry that was rolled out that Mayor mentioned. So there's so much to be done. I am incredibly passionate about the work that I have spent my career doing, and look forward to much more opportunities and the challenges that brings. So again, thank you, Mayor, for this opportunity. We're going to prove your decision is a good one.
I know that's the case. Thanks, Connie. Thank you, Connie. No proof needed. You've done an excellent job and excited about the future for you. Working also with Dr. Inder Single. Dr. Inder Single is the new executive director of the Louisville Department of Public Health and Wellness. Dr. Single has been serving patients across Louisville since 2003 as a retina specialist, and he's passionate about finding solutions to address inequalities in healthcare, in education, in affordable housing. He is the founder of the Adarsh Charitable Foundation, where he and his wife and others work to improve the lives of others through healthcare and other means to help lift them up. And outside of his professional work, he volunteers extensively, both here in Louisville and abroad as well. And even with all of his professional and other civic commitments, he recently got an MBA in 2019 from Bellarmine University. Dr. Single is always looking to learn. He is a wonderful leader. He is a fantastic doctor, and I know he is going to provide great continuing leadership to the Louisville Department of Public Health and Wellness. So, ladies and gentlemen, please join me in welcoming the Executive Director of the Public Health and Wellness Department, Dr. Inder Single.
Wow. So thank you, Mayor and Deputy Mayor George. It is truly an honor and a privilege to serve your administration in the city of Louisville. I have learned so much since I joined as interim medical director about a year ago. I don't think many people in our community know what all Louisville Metro Health and Wellness does on a daily basis to keep us safe. I know both Connie and the mayor alluded to some things. List is long. I'm not going to bore you. It will take 2 hours if I go through everything, but I'll mention a few things and repeat some things. Our team plan and prepares and practices responses for disasters or pandemics like COVID. LUVAX under Louisville Metro Health and Wellness was an extremely in this season to make sure that we protect you from mosquito-borne diseases. We make sure the food we eat at our favorite restaurants is safe. We prevent environmental hazards. Nick is here, who's leading the environmental department at Louisville Metro Health. We test for lead, which can cause harm to our children and their growth and development. We ensure mother, children, and their families have access to care and food. With our WIC program and Healthy Start, we serve over 15,000 families in Louisville. We enforce laws, the smoke ordinance. We prevent safety hazards at hotels, the pools, and the tattoo parlors. We connect people to medical care, services, sport, and recovery. But we are one of the very few health departments with an embedded Center for Health Equity, where we meet our community members, community leaders, and we analyze data, and then we come to address the health inequities. I want to talk about health inequities a little bit here. Health inequities is a reality for thousands of our neighbors in Louisville and millions of Americans. It's a reality that needs our urgent attention. It's a glaring barrier that prevents individuals from achieving their fullest potential. One's zip code should not be a determinant of one's life expectancy. One's color of skin or gender should not be a determinant of one's ability to access care and have good care or quality care. Access to health care, healthy food, clean environment, affordable housing is not a privilege. It's a basic human right. We must invest in our community and community driven solutions so we address the root causes for this inequities and empower communities. Louisville Metro Health and Wellness has launched its 2024 Community Health Assessment and Community Health Improvement Plan. We are reaching our community, we're learning what they need to live healthy lives. Along with our community partners, leaders, we'll soon present a roadmap towards helping everyone live a healthy life and thrive. We can find sustainable solutions, but it requires time and perseverance. There are no quick fixes to this. Our Louisville Metro Health team is leading the charge. Together, we do have the power to redefine what it means to live in an equitable society. In the past 6 months, we have made great progress. We have been working with JCPS and our community partners like Galen and Sullivan School of Pharmacy to close the immunization gap at JCPS. There are about 25,000 students who are either not fully immunized